Without wasting time, let's go on to today's paper discussion. Good evening, everyone. So, put pen and paper with you. Put pen and paper near you. So, coming on to our first question, today's first question. Total number of lobes in liver. Total number of lobes in liver, and you'll be having 4 lobes. First one is right lobe. Second one is left lobe. And third one is caudate lobe. Third one is caudate lobe. And fourth one is quadrate lobe. ఈ caudate quadrate lobes ఎక్కడెక్కడ ఉంటాయంటే caudate lobe is located between your left and right lobe. Left and right lobe కి మధ్యలో caudate lobe అనేది ఉంటుంది. But coming on to quadrate lobe, it is situated in the inferior surface of your right lobe. Right lobe లోపల ఉంటుంది. But coming on to caudate lobe, this caudate lobe is present between right and left lobe. Right and left lobe మధ్యలో caudate lobe ఉంటుంది. But quadrate lobe, it is present inside your right lobe. Right lobe లోపల ఉంటుంది quadrate lobe. Is first question clear for you all? Then second question. Metriphonate is effective against. Metriphonate is effective against schistomiasis. Schistomiasis. So metriphonate means it is one of the irreversible organophosphate acetylcholinesterase. ఈ మెట్రిఫోనేట్ అనేది irreversible organophosphate acetylcholinesterase. Schistosomiasis means it is one kind of parasitic infection. Then third question, which of the following drugs is not derived from marine? Not derived from marine ante, one second. Vancomycin is not derived from marine organisms. Vancomycin vancomycin is derived from one kind of soil bacteria. మిగతా అన్ని marine organisms, but vancomycin it is derived from one kind of soil bacteria. Then fourth question, which of the following immunity is present in our present from birth ante innate immunity. Innate immunity. Active immunity ante enti? Can anyone answer what is active immunity? Can anyone answer what is active immunity? This remdesivir is derived from fruit bats. Fruit bats. Indirectly, it is derived from fruit bats. Okay. Active immunity ante, it develops due to generation of our antibodies. Antibody mediated. Yes, good. 1 or 2. I don't know what is your name, but it is good. Passive immunity ante enti? It is developed due to introduction of antibodies only. But immediate ga untundi action. And activity అనేది only short period of time ఉంటుంది. It is not everlasting. Passive immunity. And coming on to fifth question. Fifth question, which of the following drugs is derived from plants? Even this is also the direct question. This is vinblastin. Vinblastin. Then sixth question, which of the following drugs is derived from synthetic compound? Synthetic compound ante fluoxetine. Fluoxetine is derived from synthetic compound. You note one point about fluoxetine. It is selective serotonin reuptake inhibitor. It is selective serotonin reuptake inhibitor. It inhibits the serotonin reuptake and increases the serotonin activity. And it increases the serotonin activity. Uses ante, it is mainly used to treat depression, anxiety and mood disorders. Depression, anxiety, mood disorders. Sixth question clear? Huh? Did you note whatever the points I had told you? Then seventh question, the date on prescription tells us. Even this is also a direct question. It tells the date of writing the prescription and date of presentation of prescription. So both A and B are correct. 8th question, pharmaceutical suspensions are generally. అంటే pharmaceutical suspensions two types ఉంటాయి, flocculated, deflocculated. But generally we'll be using the flocculated suspensions. Generally, most commonly we'll be using the flocculated suspensions. Why? Because whatever the particles that are suspended in flocculated suspension are loose and fluffy and they can settle quickly. So for this reason, we'll be mostly using flocculated suspensions. Suspensions are two types, but most commonly we'll be using this flocculated suspensions. Yes, because no hard cake is also formed. Hard cake and a form of flocculated suspensions. So for that reason, we'll be using generally flocculated suspensions. Then 9th question. In stationary growth phase, the growth is, ఇది చెప్పండి, నేను సెకండ్ మాక్ ఎగ్జామ్ అప్పుడు ప్రతి ఒక్క ఫేజ్ రాయించాను, లాగ్, లాగ్, స్టేషనరీ, డిక్లైన్ ఫేజ్, ప్రతి ఒక్క దానికి రాయించాను. ఎస్, ఈక్వల్ టు డెత్ రేట్. Then 10th, which of the following are ultra short acting barbiturates? Ultra short acting barbiturates ante thiopental. But note one point about each drug. Secobarbital plus amobarbital. Secobarbital, amobarbital, both are short acting phenobarbital. Short acting barbiturates. Phenobarbital ante long acting. Phenobarbital ante long acting. Secobarbital, amobarbital అనేవి short acting. Phenobarbital is long acting drug. Then 11th question. Cotrimoxazole is used in all except. Even this is also the direct question. It is not used in malaria. It is used in urinary tract infections, GIT tract infections and respiratory tract infections. Anitlo use చేస్తారు. Then 12th, the particle size in suspension is, even this is also the direct question, it is greater than 10 to the power of 3. Then 13th question, dash powder must be sterile. Both medical powders, surgical powders, rendu sterile gane undali. And 14th, which of the following is an example of hydrophilic base? It is glycerogelatin base. Glycerogelatin base. Hydrogenated oils emo, it exists as hydrophobic bases. Hydrogenated oils, emulsified cocoa butters, rendu hydrophobic bases examples. Hydrogenated oils, emulsified cocoa butters, these both are examples of hydrophobic bases. Then 15th, the rate of generation of new bacterial cell becomes equal to the death rate during which phase? I need the answer from you. Yes, stationary. Then 16th, which of the following is not an example of synthetic drug? Cannabis is not a synthetic drug. It is derived from cannabis plant-based drug. Then 17th, the T helper 1 cell releases cytokinins to activate macrophage or T cells and cause direct cellular damage. Which of the following hypersensitivity reactions are mediated by sensitized T helper 1 cells? This is direct question. That is type 4 hypersensitivity reactions. Then 18th question, the animal used for monoclonal antibodies. Which animal will be using? Will be using mouse. Mice. Then how many chambers of heart are there? 4 chambers. Then 20, which of the following drug is not derived from animal? Which of the following drug is not derived from animal? Cocaine, it is not derived from animal, it is derived from coca leaves. Then 21, single molecule of a glucose generates dash molecules of acetyl-CoA which enters into Krebs cycle. Even this is also direct question, it generates two molecules. Then 22, uncoated nitroglycerin is orally effective because of his high first pass metabolism. Then 23, which body is entrusted with task of maintenance central register of pharmacist? Is a direct question, that is Pharmacy Council of India. Pharmacy Council of India. All of the following are used for myoclonic scissors except is the direct question. That is carbamazepine is not used for myoclonic scissors. Myoclonic scissors ante these are one type of generalized scissors. So characteristics ante rapid, brief, involuntary muscle contractions అనేవి అయితే. These are the symptoms. Then carbamazepine, it is used for focal seizures and trigeminal neuralgia. It is not used for myoclonic seizures. It is used for focal seizures and trigeminal neuralgia. Then 25th, dash is a protozoal disease. If this is a direct question, that is malaria. Then 26th, which of the following statement is not true? Which of the following statement is not true? Then first options tell them glycogen metabolism is divided into 4 parts. It is wrong. It is divided into only 2 parts. One is glycogenesis, okate glycogenolysis. 4 parts la divide avadu. Glycogenesis is synthesizes glycogen, is correct. Glycogen metabolism occurs in muscles and liver, it is correct. The concentration of liver glycogen is greater than muscle. Yes, it is correct. But option A is wrong. It is divided into only 2 parts. One is glycogenesis and the other one is glycogenolysis. Then 27, drug used in irritable bowel syndrome with constipation is. So, lubiprostone. Your answer is lubiprostone. But note one point about each and every drug. Lubiprostone. First lubiprostone gurinche cheptunnanu. It is an antidiarrheal drug. It is an antidiarrheal drug. Works by increasing the fluids in intestine. Works by increasing the fluids in intestine, which helps to soften the stools. Which helps to soften the stools and promote the bowel syndrome. And promote the bowel syndrome. Then loperamide, it binds to opiate receptors. It binds to opiate receptors in gut wall. It binds to opiate receptors in gut wall. Therefore, it reduces the activity of mesenteric plexus present in the intestine. Mesenteric plexus present in the intestine. Loperamide binds to opiate receptors in gut wall so that it reduces the activity of mesenteric plexus present in intestine. Allosterone, it is a selective serotonin 5-HT3 receptor antagonist. Allosterone is selective serotonin 5-HT3 receptor antagonist. Coming on to clonidine, it is alpha-2 adrenergic receptor agonist. Adrenergic receptor agonist. Alpha-2 adrenergic receptor agonist. It will mainly stimulate the presynaptic alpha-2 adrenergic receptors. It will stimulate the presynaptic alpha-2 adrenergic receptors so that it will decrease the noradrenaline release. So that it will decrease the noradrenaline release from both central and peripheral sympathetic nervous system. From both central and peripheral sympathetic nervous system. Note cheskunnara? Did you note it all? Andaru note cheskunnara? Allosterone is selective serotonin. Allosterone is selective serotonin 5-HT3 receptor antagonist. 5-HT3 receptor antagonist. Allosterone is selective serotonin 5-HT3 receptor antagonist. Clonidine, it is alpha-2 adrenergic receptor agonist. Alpha-2 adrenergic receptor agonist. It will mainly stimulate presynaptic. It will stimulate presynaptic alpha 2 adrenoreceptor, alpha 2 adrenoreceptor, thereby it decreases noradrenaline release, thereby it decreases noradrenaline release from both central and peripheral sympathetic nervous system, from both central and peripheral sympathetic nervous system. నోట్ చేసుకున్నారా? కంప్లీట్ అయిందా రాయడం? ఓకే. 28. Which of the following statement about octreotide is true? It is used in secretory diarrhea. It is true. But note one point. All of you note one point about octreotide. Note one point about octreotide. It is a synthetic hormone. It is a synthetic hormone. Octreotide is a synthetic hormone similar to somatostatin. Similar to somatostatin. Octreotide is synthetic hormone similar to somatostatin. Coming on to mechanism of action of octreotide. Octreotide. It inhibits growth hormones. It inhibits growth hormones, insulin, and glycogen and glucagon. Octreotide is synthetic hormone similar to somatostatin. It inhibits growth hormones, insulin and glucagon. And it is used to treat secretory diarrhea, acromegaly, and some other types of cancer. Note చేసుకున్నారా అది? Yes. 29th. Which of the following is not an example of water in oil type emulsion? Milk is not an example of water in oil type emulsion. It is an example of oil in water type of emulsion. Milk అనేది oil in water type of emulsion కి example. And 30. Most of the cardiac muscles in heart are found in myocardium. Note. Then 31. Which of the following methods of sterilization is most suitable for sterilizing the liquids? It is filtration. And 32. Dash contains one water molecule that acts as a binder in fusion method for making effervescent granules. One second. I'm getting a call. Can you hear my voice? Sorry, I got an important call. Okay. 32. Dash contains one water molecule that acts as a binder in fusion method for making effervescent granules. And the direct question, that is citric acid. Then coming on to 33 question. What is the difference between vanishing cream and cold cream? Difference adigaru mani. What is the difference between vanishing cream and cold cream? That is vanishing cream. Vanishing cream anedi oil in water type of emulsion, whereas cold cream is water in oil type of emulsion. Option B is correct. Then for 34, cake formation is characteristic feature of deflocculate. Deflocculated. Then 35, bacteria growing best in atmosphere 5 to 10% of carbon dioxide. I need the answer from you. నేను మీకు notes కూడా dictate చేశాను. That is capnophilic. Then 36, which of the following anti-anginal agent can relieve coronary vasospasm? Idi direct question, that is nifedipine. Nifedipine. So note one point about nifedipine. Note one point about nifedipine. It is anti-anginal drug. It is anti-anginal drug. Calcium channel blocker. Calcium channel blocker. It relaxes smooth muscles. It relaxes smooth muscles in the walls of blood vessels. In the walls of blood vessels. Therefore, it relieves coronary vasospasm. Therefore, it relieves coronary vasospasm. Therefore, it relieves coronary vasospasm. Note the second point. Note the second point. First point note చేసుకున్నారా? Did you note the first point? Are you there in the class? Then coming on to second point. Verapamil diltiazem. Verapamil plus diltiazem. Verapamil plus diltiazem are also the calcium channel blockers. Are also the calcium channel blockers. Treats angina. Treats angina. Put 3 star mark and write this point. But not effective in treating coronary vasospasm. But not effective in treating coronary vasospasm. Verapamil diltiazem calcium channel blockers say it will treat angina, but they are not effective in treating coronary vasospasm. They are not effective in treating coronary vasospasm. Propranolol is also the beta blocker. It is also used to treat angina. It is also used to treat angina. Note చేసుకున్నారా points? 37. Which of the following is disadvantage of using ethylene oxide gas for sterilization? It is carcinogenic. And 38. Which artery supply blood to tissue of the heart? I need the answer from you. Coronary artery. Then 39. Which of the following drugs is not derived from the plant? Not derived. Not derived ante erythromycin. Then half-life of transfused platelets. I need the answer from you. It is direct question. It is 4 days. Then 41. Which of the following is not an ideal property of base? Which of the following is not an ideal property of base? Ante the ideal property shall be non-irritant, shall not interfere in the drug release. So your answer is none of them. Then which of the following is a bacterial disease? Which of the following is a bacterial disease? That is typhoid. And 43, sterilization by ionization radiation is known as. Even this is also the direct question. That is cold sterilization. Cold sterilization. Amoebiosis is protozoal disease. Amoebiosis is protozoal disease. Then creaming is reversible. Creaming is reversible. Then 45. Which of the following is an example of synthetic base? Which of the following is an example of synthetic base? Ante correct answer hydrogenated oils. Correct answer is hydrogenated oils. Vitpol anedi, it is one kind of wax. Wheat pool is one kind of wax, and emulsified cocoa butter is, it is a mixture of cocoa butter and water. It is a mixture of cocoa butter and water. So my answer hydrogenated base is your synthetic base. Wheat pool is not a synthetic base, it is one kind of wax. So your answer is hydrogenated base. Hydrogenated oils is your correct answer. Wheat pool అనేది ఒక wax. We will be using this wheat pool for production of candles. It is not a synthetic base. Then 46. Clark's formula to calculate pediatric dose uses body weight in pounds. Which of the following formula is correct? ఇది చాలా టైమ్స్ రిపీట్ అయింది క్వశ్చన్. ఆప్షన్ బి is correct. Then 47. Rate of sedimentation is high in. Rate of sedimentation is high in flocculated forms. Then 48. Drug of choice for supraventricular tachycardia. Supraventricular tachycardia అంటే మీకు ఎడ్మింగిల్ యాప్ లో చేంజ్ చేశారు, నా పీడిఎఫ్ లో నేను చేంజ్ చేయలేదు. That is verapamil and diltiazem. We can use both verapamil and diltiazem. And 49. Which of the following drugs is derived from synthetic compound? Even this is also a direct question. That is acetaminophen. Can you hear my voice? Actually, I'm using my mobile data. If it is not clear, I'll rejoin once. Can you hear my voice? Okay. Okay. Then question number 50. Which of the following is a prokinetic drug? Which of the following is a prokinetic drug? Ante domperidone. Note one point. One point. ఒక్కొక్క పాయింట్ నోట్ చేసుకోండి. Domperidone. It is a prokinetic. It is a prokinetic drug. It stimulates the movement of. It is a prokinetic drug. It stimulates the movement of. 48 answer verapamil diltiazem. Both A and B are correct. మీ ఎడ్మింగిల్ యాప్ లో చేంజ్ చేశారు, బట్ నా పీడిఎఫ్ లో నేను చేంజ్ చేయలేదు. Your answer is both A and B. Verapamil diltiazem. Okay, 50 question కి ఒక్కొక్క పాయింట్ నోట్ చేసుకోండి. Domperidone. It is a prokinetic drug. It is a prokinetic drug. It stimulates the movement of food. It stimulates the movement of food and fluids through the digestive system. Through the digestive system by enhancing the contraction of muscles. By enhancing the contraction of muscles in stomach and intestine. In stomach and intestine. Domperidone. It is one kind of prokinetic drug. It stimulates the movement of food and fluids through digestive system by enhancing the contraction of muscles in stomach and intestine. Then second option, cimetidine. It is H2 receptor antagonist. It is H2 receptor antagonist. Mainly decreases the HCl production. Decreases the HCl production. Ondansetron ante antiemetic. You know about this. Then hyoscine. It is anticholinergic drug. It is anticholinergic drug, mainly used for treating motion sickness and GI spasm. Motion sickness and GI spasm. Hyoscine, it is anticholinergic drug, mainly used for treating motion sickness and GI spasm. Did you note what I'm telling? Note చేసుకున్నారా? Okay, coming on to 51st question. Which of the following drug is derived from traditional medicine? Quinine. Quinine. Then 52, which of the following drug is not used for anxiety? Not used for anxiety ante halovendol. Halovendol. But note one point about each drug. Haloperidol. Halovendol kaadu idi. Haloperidol. It is antipsychotic drug. It is antipsychotic drug. It is antipsychotic drug. Then propranolol గురించి ఒక పాయింట్ నోట్ చేసుకోండి. It is a beta blocker, but sometimes it is used to treat. It is used to treat the symptoms of anxiety. The symptoms of anxiety, such as rapid heartbeat, and tremors. Propranolol, it is a beta blocker. Sometimes it is used to treat symptoms of anxiety such as rapid heartbeat and tremors. Then alprazolam. Alprazolam, it is a benzodiazepine drug. Alprazolam, it is a benzodiazepine drug used to treat anxiety. Used to treat anxiety. Then buspirone, it treats generalized anxiety disorders. Generalized anxiety disorders. Generalized anxiety disorders. Note చేసుకున్నారా? నోట్ చేసుకున్నారా నేను చెప్పిన పాయింట్స్? Then 53. Learning is related to which part of brain? Learning is related to which part of brain? It is related to cerebellum. It is related to cerebellum. But note one point. ఒక్కొక్క పాయింట్ నోట్ చేసుకోండి. Cerebrum. First cerebrum. I'm telling one point about each and every part of the brain. What are its functions? First cerebrum functions ఏంటి అంటే conscious thoughts. Yes, okay. Conscious thoughts, learning memory, commas పెట్టుకోండి. Learning memory, 1 second. And language processing. Cerebrum. Conscious thoughts, learning, memory, and language processing. Medulla oblongata, breathing, heart rate controls. Hypothalamus, homeostasis. Sorry. First functions అనేవి cerebellum. First functions are the functions of cerebellum. First ఏవైతే చెప్పానో అవి cerebellum. Then cerebrum, last cerebrum. Coordinates the movement and balance. అలా ఒకసారి రిపీట్ చేస్తున్నాను. Cerebellum functions, conscious thoughts, learning, memory, and language processing. Medulla oblongata అంటే breathing, heart rate control. Hypothalamus, homeostasis. Cerebrum, coordinates movements and balance. నోట్ చేసుకున్నారా? If I'm going fast, you tell me, madam, go slow. Why? Because these points are important. Then 54th question. What is true about calcium channel block them. What is true about calcium channel blocker ante nifedipine causes reflex tachycardia. Then 55. Incubation period for gangrene is. Can you hear my voice? Yes. Okay. 55th question, gangrene incubation period ante 1 to 3. 1 to 3. Do you know what is the meaning of gangrene? Gangrene meaning తెలుసా? Gangrene అంటే if the tissue dies, ఒకవేళ టిష్యూ అనేది చనిపోయింది అనుకోండి డ్యూ టు ల్యాక్ ఆఫ్ బ్లడ్ సప్లై, దాన్ని గ్యాంగ్రీన్ అనేసి. డెప్త్ ఆఫ్ బ్లడ్ సప్లై లీడ్స్ టు డెత్ ఆఫ్ ద టిష్యూ. బ్లడ్ మనకి ఏదైనా పర్టికులర్ టిష్యూకి బ్లడ్ సప్లై రాలేదనుకోండి, దాన్ని మనం గ్యాంగ్రీన్ అనేసి. 56. Which of the following is not a symptom of Crohn's disease? Not a symptom of Crohn's disease ante weight gain. Weight gain is not a symptom of Crohn's disease. Do you know the meaning of Crohn's disease? Crohn's disease ante enti? Crohn's disease meaning teliste chat box lo chat cheyandi. If you don't know also, you tell me don't know. But don't waste time. Yes, correct. Then 57, the first edition of Indian Pharmacopoeia was out in. The direct question, that is 1955. Then 58, common side effect of cisapride. Even this is a direct question, that is diarrhea. Cisapride mainly acts through stimulation of serotonin 5-HT3/4 receptors. Cisapride ఎట్లా యాక్ట్ చేస్తుందంటే serotonin 5-HT3 receptors. Serotonin 5-HT3 agonist. Category అంటే 5-HT3 agonist. Serotonin 5-HT4 agonist. Cisapride is serotonin 5-HT4 receptor agonist. Category ఇది 5-HT4 agonist. Then 59. In case of coalescence, even this is also a direct question, dispersion droplets tends to fuse. మొత్తం droplets అన్ని fuse అయ్యి ఒక లాంగ్ బిగ్ droplet లాగా ఫామ్ అవుతుంది coalescence లో. Then 60. Calcium channel blocker used in all except it is not used in 6 sinus syndrome. Do you know the meaning of 6 sinus syndrome? 6 sinus syndrome అంటే ఏంటి? ఒక మాక్ ఎగ్జామ్ లో చెప్పాను 6 sinus syndrome definition. If you know, you can chat. I know you can tell the answer. If you don't know, ma'am, you can explain. You can chat in the chats. ఇది SA node disorder. It is one kind of sinoatrial node disorder. ఈ 6 sinus syndrome లో సైనోఎట్రియల్ నోడ్ నుండే కదా మనకి మొత్తం హార్ట్ బీట్ అనేది ఇనిషియేట్ అయ్యేది. ఈ సైనోఎట్రియల్ నోడ్ అనేది ఫెయిల్ అయింది అనుకోండి, మనకి హార్ట్ బీట్ అనేది ఇనిషియేట్ అవ్వదు. సో ద ట్రీట్మెంట్ ఫర్ ది 6 sinus syndrome అంటే టాబ్లెట్స్ అవి ఏమి ఉండవు. ద ఓన్లీ థింగ్ ఈస్ యూ హ్యావ్ టు ప్లేస్ ద పేస్ మేకర్ ఇన్ యువర్ హార్ట్. పేస్ మేకర్ ప్లేస్ చేస్తేనే మనకి హార్ట్ బీట్స్ అనేవి ట్రాన్స్మిట్ అవుతాయి. This is the meaning of 6 sinus syndrome. Then 61. Which of the following is an advantage of suppositories? Can be given in unconscious patients lo kuda ivachchu. Then 62. Which of the following statement is true about IgM in human bodies? It is IgM is primarily restricted in the circulation. Then 63. Side effects of imipramine. Side effects of imipramine ante urinary retention. Imipramine mechanism of action already నేను చాలా మాక్ టెస్ట్లలో చెప్పాను. ఈవెన్ సైడ్ ఎఫెక్ట్స్ కూడా చెప్పాను. గుర్తున్నాయా? మళ్ళీ చెప్పమంటారు. ఏట్రోవెంట్రికులర్ బ్లాకెడ్ అంటే ఫస్ట్ మనకి ఎస్ఏ నోడ్ అంటే ఏంటి అసలు మనకి హార్ట్ బీట్ అనేది ట్రాన్స్మిట్ అయ్యేది అక్కడ నుండి ఫ్రమ్ ఫ్రమ్ సైనోట్రియా ఏట్రియా నుండి వెంట్రికల్స్ కి వెళ్తుంది అది. దెన్ 64 ఫాలోయింగ్ ఆర్ ద డిజార్డర్స్ ఆఫ్ కార్డియోవాస్కులర్ సిస్టమ్. ఇవన్నీ డిజార్డర్స్. గ్లాకోమా అనేది కార్డియోవాస్కులర్ డిజార్డర్ కాదు. దెన్ ఫస్ట్ లైన్ యాంటీ ట్యూబర్కులర్ డ్రగ్ అన్ని ఆల్. దెన్ 66 ఫస్ట్ లైన్ యాంటీ ట్యూబర్కులర్ డ్రగ్స్ కి ట్రిక్ రాసుకోండి. పేరిస్ పేరిస్ PERIS. ఈ ట్రిక్ ఒకటి గుర్తుపెట్టుకోండి. ద లెటర్స్ ఆర్ ద ఫస్ట్ స్టార్టింగ్ లెటర్స్ ఆఫ్ యువర్ డ్రగ్. యూరినరీ రిటెన్షన్ సైడ్ ఎఫెక్ట్ ఆఫ్ ఇమిప్రమిన్ అంటే యూరినరీ రిటెన్షన్. 63 side effects of imipramine are urinary retention. Then 66 ఈ 65 ఫస్ట్ లైన్ యాంటీ ట్యూబర్కులర్ డ్రగ్స్ కి ట్రిక్ నోట్ చేసుకున్నారా? Did you note the trick what I had told you? First line drugs. ఆ డ్రగ్స్ నేమ్స్ గుర్తులేకపోయినా ఎస్ పేరిస్. పేరిస్ అంటే దీస్ ఆర్ ద ఫస్ట్ లెటర్స్ ఆఫ్ యువర్ ఫస్ట్ లైన్ డ్రగ్ ఎగ్జాంపుల్స్. ఫస్ట్ లైన్ డ్రగ్స్ ఫస్ట్ లెటర్స్ అమ్మా అవి. అవన్నీ గుర్తుపెట్టుకోవడం కష్టం కాబట్టి ట్రిక్ చెప్పాను. ఆ టైంలో మీకు డ్రగ్స్ గుర్తులేకపోతే ఆ ట్రిక్ యూజ్ చేసి రాయండి. దెన్ 66 ఇమ్మిసిబిలిటీ ఆఫ్ ఆయిల్ అండ్ వాటర్ కెన్ బి ఓవర్కమ్ బై. ఇది డైరెక్ట్ క్వశ్చన్. ఇట్ ఈస్ ఓవర్కమ్ బై ఫార్ములేటింగ్ యాజ్ అన్ ఇమల్షన్. Then 67 filariasis is a disease caused by Ucheraceae bancroft. And 68 if a person has lost memory in accident, which of the following part of the drug is injured? Which of the following part of the drug is injured? I need the answer from you. ఇప్పుడే నేను మీకు ఫంక్షన్స్ చెప్పాను. Yes. Good. And 69 what is the minimum concentration of alcohol required for effective disinfection? That is option B, 70%. Whatever the functions I had told you, అది నేను టొరటోరా బుక్ నుండి తీసుకున్నాను. ఒక టేబులర్ కాలం అనేది ఉంటుంది. సో ఫ్రమ్ దట్ టేబులర్ కాలం I had dictated you the functions of each and every part. Then 70 which of the following drugs is derived from traditional medicinal plant? ట్రెడిషనల్ మెడిసినల్ ప్లాంట్ అంటే ఆర్టెమిసినిన్ మలేరియాకి ట్రీట్ చేస్తాం. దెన్ సైడ్ ఎఫెక్ట్స్ ఆఫ్ అమ్యోడరన్ ఆర్ ఆల్ ఎక్సెప్ట్ అనేసి ఇచ్చారు. దట్ ఈస్ నెఫ్రోటాక్సిసిటీ అనే సైడ్ ఎఫెక్ట్ కాదు. అమ్యోడరన్ ఈజ్ ఎ క్లాస్ 3 యాంటీ-అరిథమిక్ డ్రగ్. క్లాస్ 3 యాంటీ-అరిథమిక్. దెన్ 72 న్యూరాన్ సెల్ ఈజ్ మేడ్ అప్ ఆఫ్ విచ్ ఆఫ్ ద పార్ట్స్? అన్ని పార్ట్స్, ఆల్ దట్. Then 73 bile is helpful in digestion of. Is a direct question. Bile is helpful in digestion of fat. And 74 which of the following statement concerning the anti-inflammatory effect of NSAID are true? Anti-inflammatory effects of NSAID results to inhibition of cyclooxygenase is correct. Results inhibition of is wrong. Anti-inflammatory effects of NSAID results is wrong. So option A is correct. 74. Then 75 upward creaming is observed in. Upward creaming is observed in oil and water type emulsion. Then which of the following is an example of oily bases? It is lipo. 73 fats. క్రీమింగ్ అంటే మూమెంట్, అప్వర్డ్ మూవింగ్. ఏదైతే ఇమల్షన్, ఏదైతే సబ్స్టెన్స్ మనం తీసుకుంటామో దట్ విల్ మూవ్స్ అప్వర్డ్ అండ్ డౌన్వర్డ్ డైరెక్షన్స్. దీస్ ఆర్ ద స్టెప్స్ ఇన్వాల్వ్డ్ ఇన్ ఇమల్షన్. క్రీమింగ్, కోయాల్సన్స్, అవి స్టెప్స్ ఇన్వాల్వ్డ్ ఇన్ ఇమల్షన్. స్క్రీమింగ్ అంటే అప్వర్డ్ అండ్ డౌన్వర్డ్ మూవ్మెంట్. in the stability of emulsion, which important instability step can be prevented? Even this is the direct question. That is coalescence. Coalescence ని మనం ప్రివెంట్ చేయొచ్చు. ఇన్స్టెబిలిటీ ఎప్పుడైతుంది? మనకి ఎప్పుడైతే అప్వర్డ్ డౌన్వర్డ్ మూవ్మెంట్ అవుతుందో అప్పుడు కదా అయ్యేది. కొయాలిసిస్ అంటే ఏంటి? చిన్న చిన్న డ్రాప్లెట్స్ అనేవి ఒక లార్జర్ డ్రాప్లెట్ లాగా అవ్వడం. ఒకవేళ అది లార్జర్ డ్రాప్లెట్ లాగా అయితే అప్వర్డ్ డౌన్వర్డ్ మూవ్మెంట్ అవుతుందా మనకి? అవ్వలేదు కదా. సో ఇన్స్టెబిలిటీ ఈస్ ప్రివెంటెడ్. Flocculation is related to suspensions. Flocculation and a suspension related. Then 78. D-tubacarenin acts as. Is a direct question. That is, it acts by inhibiting the nicotinic receptors at myoneuron. నేను అన్న చెప్పిన క్లాస్ నోట్స్ రెఫర్ చేసి రోజు ఆన్సర్ చేసేవాళ్ళం. Then 79. Which of the following hypersensitivity reaction is a result of massive disposition of immune complex in various tissues and can induce complement activation and inflammation response? It is a direct question. That is type 3. Type 3. Then 80. Examples of long-acting barbiturates. Examples of long-acting barbiturates ante phenobarbital is long-acting barbiturates. డయాజిపమ్, లోరాజిపమ్ ఇవి రెండు బెంజోడయాజిపైన్స్. మెప్రోబామేట్ అనేది యాంజియోలైటిక్ డ్రగ్. యాంజియోలైటిక్ ప్రాపర్టీస్ ఉంటాయి మెప్రోబామేట్. 81. When a substances with low melting point such as camphor triturated together a liquid mixture forms this phenomenon. దీన్ని eutectic mixturation. And 82. Chemical incompatibility can be intended such that a prescriber knowingly gives incompatible drugs and unintentional such prescriber do not know the drugs are compatible and మనకి తెలియకపోతే తెలుసు. Sorry, that incompatible and తెలియకపోతే వాళ్ళకి ఇస్తాం. Your correct answer is A. Then 83. Which of the following drugs is not derived from fungus? Cocaine is not derived from fungus. It is derived from coca plant, coca leaves. Then 84. For ideal suspension, the sedimentation value should be. So, ideal suspensions ki సెడిమెంటేషన్ వాల్యూ అనేది 0 ఉండాలి. ఎందుకు అంటే యు నోట్ 1 పాయింట్. ఎందుకు అంటే ఐడియల్ సస్పెన్షన్స్ అంటే షుడ్ నాట్ అంటే సెటిలింగ్ అనేది ఓవర్ టైమ్ అనేది ఎక్కువ టైంలో ఉండద్దు. మీన్స్ ద పార్టికల్ షుడ్ రిమైన్ యూనిఫామ్లీ. సో ఇట్ ఈస్ 0. సో ఒక 3 పాయింట్స్ నోట్ చేసుకోండి. ఈ టైప్ ఆఫ్ క్వశ్చన్స్ అనేవి వస్తాయి. ఒక 3 పాయింట్స్ నోట్ చేసుకోండి. Pharmaceutical suspensions should have F value less than 1. నోట్ చేసుకుంటున్నారా పాయింట్స్? ఆర్ యు నోటింగ్? ఒక 3 పాయింట్స్ నోట్ చేసుకోండి. ఫస్ట్ అసలు ఫార్మస్యూటికల్ సస్పెన్షన్స్ కి ఏమేం వాల్యూస్ ఉండాలో ఆ ఒక్క పాయింట్ ఫస్ట్ నోట్ చేసుకోండి. షుడ్ హ్యావ్ వాల్యూస్ ఎఫ్ వాల్యూ లెస్ దాన్ 1 అయినా ఉండాలి, ఆర్ ఎల్స్ ఈక్వల్ టు 1 అయినా ఉండాలి, ఆర్ ఎల్స్ గ్రేటర్ దాన్ 1. ఈక్వల్ టు 1 ఉంటే ఏంటి, ఏం ఫినామినా ఫాలో అవుతుంది. నాట్ ఈక్వల్ టు 1 ఉంటే ఏం ఫినామినా ఫాలో అవుతుంది అప్పుడు చెప్తాను. నోట్ చేసుకోండి. ఫస్ట్ ఈ పాయింట్ నోట్ చేసుకున్నారా? ఫస్ట్ పాయింట్ నోట్ చేసుకున్నారా? ఫార్మాస్యూటికల్ సస్పెన్షన్స్ కి ఎఫ్ వాల్యూ ఈక్వల్ టు 1 అయినా ఉంటుంది, లెస్ దాన్ 1 అయినా ఉంటుంది, గ్రేటర్ దాన్ 1 అయినా ఉంటుంది. బట్ ఇన్ విచ్ కండిషన్స్ దట్ వాల్యూస్ ఆర్ అవుట్? ఫస్ట్ సబ్ పాయింట్స్, ఇఫ్ ఎఫ్ వాల్యూ ఈక్వల్స్ టు 1, if f value is equals to 1, then the product have no sedimentation. Then the product have no sedimentation. No sedimentation and no clear supernatant, no clear supernatant layer is formed on standing. This is the ideal condition. Ante mana answer equals to 1. This is the ideal condition. F value, if F value is equals to 1, then the product have no sediment and no clear supernatant liquid. So no clear supernatant layer అనేది form అవ్వదు on standing. This is the ideal condition. ఇది బాక్స్ లో పెట్టుకోండి. You put the ఇది బాక్స్ లో నోట్ చేసుకోండి. Then greater than 1. ఎప్పుడు greater than 1 ఉంటుందో నోట్ చేసుకోండి. If network of flocks is loose, and fluffy, at that time F is greater than 1. ఒకవేళ less than 1 అంటే ఆ పార్టికల్స్ అన్ని దగ్గరకు వచ్చేస్తాయి. అప్పుడు greater than 1, అప్పుడు less than 1 ఉంటుంది. ఈ పాయింట్స్ నోట్ చేసుకున్న తర్వాత నేను నెక్స్ట్ క్వశ్చన్ కి వెళ్తాను. వై బికాస్ ఈ పాయింట్స్ ఈ పాయింట్స్ బేస్ చేసుకొని మనకు క్వశ్చన్స్ ఫ్రేమ్ అవుతాయి. సో మీ ఆన్సర్ ఈక్వల్స్ టు 1. If it is equals to 1, at that time sedimentation form avadu, clear supernatant liquid kuda form avadu. This is the ideal condition. If it is greater than 1, at that time the network of flocks are loose and fluffy. If it is less than 1, the network of flocks, FLOC, flocks are loose and fluffy. If it is less than 1, the network of flocks are closely packed. Then 85th, suppository bases are maintain shape, helps in insertion into body cavity. Theobroma oil is an example. All the above. Then 86, which of the following methods of sterilization is not suitable for sterilizing powders? Is a direct question. That is, filtration is not suitable. ఎందుకు అంటే అది మైక్రోబియల్ కంటామినేషన్ ని అంత ఎఫెక్టివ్ గా రిమూవ్ చేయలేదు. సో ఇట్ ఈస్ నాట్ బెటర్ మెథడ్ ఫర్ స్టెరిలైజేషన్ ఆఫ్ పౌడర్స్. Then 87, dash are finely divided powders meant for introduction into body cavities. ఇది డైరెక్ట్ క్వశ్చన్. దట్ ఈస్ డస్టింగ్ పౌడర్స్, ఇన్సఫ్లేషన్స్ రెండు యూజ్ చేస్తాం, బోత్ ఏ అండ్ బి. మీ ఎడ్మింగ్ ల్యాబ్ లో చేంజ్ చేశారు, నా పీడిఎఫ్ లో నేను చేంజ్ చేయలేదు. కరెక్ట్ ఆన్సర్ ఇస్ డస్టింగ్ పౌడర్స్, ఇన్సఫ్లేషన్స్. Then 88, the hindbrain consists of. ఇది డైరెక్ట్ క్వశ్చన్. 88, hindbrain consists of medulla oblongata, cerebellum and pons. 89, fluoroquinolones with least bioavailability. ఇది డైరెక్ట్ క్వశ్చన్. norfloxacin. Then 90, baclofen acts as GABA B receptor agonist. 91, which of the following statement is not true? HMP shunt stands for, ఇది correct. Option A is correct. HMP shunt does not generate carbon dioxide. It is wrong. కార్బన్ డైఆక్సైడ్ ని జనరేట్ చేస్తుంది ఎక్కడ? ఆక్సిడేటివ్ ఫేజ్ లో. 2 phases ఉంటాయి కదా, ఆక్సిడేటివ్ ఫేజ్ లో కార్బన్ డైఆక్సైడ్ ని జనరేట్ చేస్తుంది. వన్స్ యూ రెఫర్ మై రిటర్న్ నోట్స్. Then option C, does not generate ATP. It is correct. It will generate 12 NADPH. 12 NADPH ని జనరేట్ చేస్తుంది. It doesn't generate ATP. It will generate 12 NADPH. Then pentose phosphate pathway takes place in cytosol. It is correct. Then 92, gram-negative bacilli may be cultured using. This is direct questioning. It is cultured using McConkey method. Then 93, the schedule of dosing is called as dose regimen. Dose regimen. Then 94, cholecystokinin is synthesized and secreted by our small intestine. Then 95, which of the following drugs is derived from animals? This is direct question. Insulin. Then 96, enzyme amylase is helpful in digestion of. This is direct question. It is helpful in digestion of carbohydrates. Then 97, the doses of children's calculated by Young's formula. నాకు ఈ ఆన్సర్ కావాలి. చాలా టైమ్స్ రిపీట్ అయింది. మన ఫస్ట్ మాక్ ఎగ్జామ్ నుండి రిపీట్ అవుతుంది. ఎస్, ఆప్షన్ ఏ ఇస్ కరెక్ట్. Then 98, which of the following system protects our body against disease causing microorganism? Immune system. Then all of the following are non-depolarizing muscular blockers except succinylcholine అనేది depolarizing neuromuscular blocker. Depolarizing neuromuscular blocker. Then 100, one of the following is topoisomerase inhibitor. Topoisomerase inhibitor. Etoposide అనేది topoisomerase inhibitor. బట్ ఒక్కొక్క ఆప్షన్ కి ఒక్కొక్క పాయింట్ నోట్ చేసుకోండి. All of you note one point about each option. Paclitaxel. Antimicrotubule agent. It is antimicrotubule agent. It will mainly targets microtubules. Causing mitotic arrest at M phase. Vincristine blocks cell growth by stopping mitosis. Vincristine blocks cell growth by stopping mitosis by interfering with microtubule polymerization. Paclitaxel ante it is antimicrotubule agent, targets microtubules, causes mitotic arrest at M phase. Vincristine ante it will block the cell growth by stopping mitosis by interfering with microtubule polymerization. Next, topotecan blocks topoisomerase 1. Etoposide అంటే it will block topoisomerase 2. ఇక్కడ ఇన్హిబిటర్ నేమ్ ఇవ్వలేదు. It will block topoisomerase 2 etoposide. మీ ఎడ్మింగిల్ యాప్ లో చేంజ్ చేశారు ఈ క్వశ్చన్ 2 అని మెన్షన్ చేశారు మీకు. Then 101, in conductivity test, if the bulb glows on passing electric current, so what would be the type of emulsion? It would be oil and water type. Then 102, dash powders consist of more than one ingredient. This is direct question, that is compound powders. If a drug consists any 50 filthy, putrid and decomposed substance, it is kept under insanitary condition. If the container is composed of any poisonous, if it contains any harmful, be toxic substance, which may be injurious to health, such drugs are called. It's a direct question, that is adulterated drug. ఈ 103 క్వశ్చన్ స్క్రీన్ షాట్ తీసుకోండి. Take the screenshot of 103 question. Then 104. Which of the following methods are used for obtaining pure culture of microorganisms? Any methods, all the. Then 105. Which of the following NSAID is non-selective COX-2 inhibitor? Non-selective. That is piroxicam. Piroxicam. Rofecoxib and celecoxib are selectively inhibits COX-2. Selective COX-2 inhibitors. Then 106. What is the recommended exposure time for ethylene oxide gas sterilization? It is 30 minutes. 30 minutes. Then 107. Oil and water are an examples of. This is a direct question. That are examples of emulsion. Then 108. Physical change may almost visible. Then 109. What type of emulsion is water in oil type of emulsion? It is a primary emulsion. Reason note చేసుకోండి దీనికి. You note the reason for this. First, water in oil type of water emulsion ante enti? It is a double emulsion. It is a double emulsion. Double emulsion ante droplets of water are dispersed. Droplets of water are dispersed in an aqueous solution. Droplets of water are dispersed within larger droplets of water. Malli repeat chestunnanu. Water in oil water emulsion is double emulsion in which small droplets of water are dispersed within larger droplets of oil. Larger droplets of oil, which are in turn dispersed in a aqueous solution. This type of emulsion is also known as water in oil in water type emulsion or water in oil in water type primary emulsion. Primary emulsions. Micro emulsions ante these are transparent or translucent thermodynamically stable dispersions of oil and water that are stabilized by an interfacial film of surfactant. They are generally single phase systems. And do not have distinct internal and external phases. మనం differentiate చేయలేం. Which point you want to repeat, ma? Once tell me. A point repetition కావాలి. Okay, repeat చేయమన్నారు, but A point. From which point? Micro emulsions. Micro emulsions are transparent or translucent. Thermodynamically stable dispersions of. Stable dispersions of. Can you hear my voice? Can you hear my voice? Are the stable dispersions of oil and water that are stabilized by an interfacial film of surfactant. They are generally single phase systems and do not have distinct internal and external phases. Distinct internal and external phases. అదే మనకి వాటర్ ఇన్ ఆయిల్ అండ్ వాటర్ టైప్ ఆఫ్ ఇమల్షన్స్ లో మనం టూ ఫేజెస్ ని డిఫరెన్షియేట్ చేయగలుగుతాము. కానీ ఈ మైక్రో ఇమల్షన్స్ లో మాత్రం ఇంటర్నల్ ఎక్స్టర్నల్ ఫేజ్, ఇది ఇంటర్నల్ ఇది ఎక్స్టర్నల్ అని మనం కరెక్ట్ గా డిఫరెన్షియేట్ చేయలేము. So this is the explanatory part for your 109 question. 110. Dye test which is used to identify the type of emulsion in that the dye used is. A dye use chestam. We'll be using scarlet green. Then 111. What is the recommended pore size for filters used in filtration? I need the answer from you. Filtration. That is 0.22 microns. 112. Which of the following steps in the preparation of powders is very often used? 112. Preparation of materials. Then 113. Which of the following is a substituent for theobroma oil? This is direct question. That is hydrogenated oils. Then 114. What is the dispersion of a liquid in another liquid called? Emulsion. Then 115. Which of the following is not an example of hydrophilic bases? Not an example of hydrophilic bases ante emulsified cocoa butter is not an example of hydrophilic basis. And 116. Which of the following is not a method to test the type of emulsion? That is మీకు ఆప్షన్స్ చేంజ్ చేశారు. సో ఆప్షన్ క్వశ్చన్ చేంజ్ అయింది, ఆప్షన్స్ చేంజ్ చేశారు. నా దాంట్లో చేంజ్ చేయలేదు. సో క్వశ్చన్ చేంజ్ అయింది చెప్తాను. Which of the following is a method to test the type of emulsion? So answer all the above. Microscopic conductance, coagulation, dye method. మీకు క్వశ్చన్ చేంజ్ చేశారు. నా PDF లో నేను చేంజ్ చేయలేదు. ఎస్, అదే మీకు క్వశ్చన్ చేంజ్ చేశారు. నేను నా PDF లో నేను చేంజ్ చేయలేదు. Then 118. Coming on to 118. Which of the following methods of sterilization is effective against virus? This is direct question. That is gas sterilization. Then syphilis is caused by Treponema pallidum. 116 మీకు క్వశ్చన్ చేంజ్ చేశారు. ఇఫ్ టైం పర్మిట్స్ లాస్ట్ లో మీకు 116 క్వశ్చన్ చేంజ్ చేసిన క్వశ్చన్ వాటి ఎక్స్ప్లెనేషన్ రాయిస్తాను. యు వెయిట్ టిల్ లాస్ట్. 116 you don't worry. If time permits, I'll definitely explain you. 117. Which of the following statement about anti-epileptic drug is false? Phenytoin is correct. Option D is false. This lamotrigine mainly blocks the sodium channels. Chloride channels ne kaadu, sodium channels ne block chesti. Then 120. Which of the following layer consists cardiac muscles? Myocardium. Then 121. Which of the following drug is derived from the minerals? It is lithium. Lithium. Then 122, calcium channel blocker used to treat the hypertension include. Used to treat the hypertension include ante nifedipine. Nifedipine. 123, filter which is disposable of single use disc made of asbestos is. Idi direct question hai. That is SITS filter. Then 124, which of the following method of sterilization is most commonly used for sterilizing the surgical instruments? It is direct question, that is autoclaving. Autoclaving. 125, rifampicin acts by inhibiting. This is direct question. It acts by inhibiting DNA dependent RNA polymerase. A question is screenshot this 125. You take the screenshot of 125 question. Which of the following drug is not derived from the plant? This is direct question. Amoxicillin is not derived from the plant. Then the total number of state pharmacy council members 15. 15. 15 lo 7 members are elected, 7 members are elected, 5 members are nominated, and 3 members are ex officio members. Then chemically aspirin is acetyl salicylic acid. Then 129, what is the basic unit of nervous system? Neurons. Neurons. Then 130, which of the following drug is derived from the venomous animal? Snake antivenom. Snake antivenom. Snake antivenom. All the statements are true about fluoroquinolones except అనేది ఇచ్చారు. That is increasing neuromuscular blocking agent. ఇది కాదు. Rest all are correct. Rest all are correct. Then 132, select the drug from the following that shows significant interactions with allopurinol. The direct question. That is mercaptopurine. Mercaptopurine. Then 133, alpha methyl dopa primarily used for pregnancy induced hypertension. Pregnancy induced hypertension. Then pediatric dose can be calculated by considering the all the above. Then 135, hypnotic drugs function enti? They should produce drowsiness and onset of sleep. Then 136, Schedule S of the Drug and Cosmetic Act. S ante shine, cosmetics. Standards for cosmetics. మనం మేకప్ ఎందుకు వేసుకుంటాము? బాగా కనిపించడానికే కదా. S ante shine. Then 137, what is the main function of hexokinase? What is the main function of hexokinase ante? Both options. Option C. Then 138, which of the following is not an antifungal drug? Neomycin is not an antifungal drug. It is aminoglycoside. Then broad spectrum antiviral drug is. Broad spectrum antiviral drug ante 4-carnet. Then 140, in microemulsion the size of globules is. In microemulsion the size of globules is 0.01 microns. Then 141, the tail of surfactant molecules is oil loving known as. Is a direct question. That is lipophilic. Strategy to correct the eutectic mixture formation is. Is a direct question. Both A and B. Then 143, live oral polio vaccine is Sabin vaccine. Sorry, నేను మీకు వ్యాక్సిన్స్ టేబులర్ ఫామ్ షేర్ చేస్తా అనేసి అన్నాను కదా. ఐ హ్యాడ్ లెఫ్ట్ అవుట్ విత్ వన్ టాపిక్, మోనోక్లోనల్ యాంటీబాడీస్. ఆ రిటర్న్ నోట్స్ తో పాటు అది షేర్ చేస్తా. వ్యాక్సిన్స్. Then 144, what is the location of pentose phosphate pathway takes place? Cytosol. Which of the following statement regarding emulsion is false? Ante emulsions cannot separate into their liquid constituents and adi wrong. Meetha ani correct. Then 146, what valve separates the stomach and duodenum? Idi direct question, that is pyloric sphincter. Then 147, if the viscosity of continuous phase increases, so creaming also decreases. In 148, in case of oil and water type emulsion, screening takes place at upward. 149, the Vice President of Pharmacy Council of India is. Idi okkar manaki repeated question. I need the answer from you. Elected by its members itself. Then, which chapter of Pharmacy Act 1948 deals with the registration of pharmacist? It is chapter 4. Chapter 4. సో 116 క్వశ్చన్ నా పీడిఎఫ్ లో నేను చేంజ్ చేయలేదు. మీకు క్వశ్చన్ ఆప్షన్స్ చేంజ్ చేస్తారు. ఫస్ట్ నోట్ ద క్వశ్చన్, ఈచ్ అండ్ ఆప్షన్ కి ఎక్స్ప్లెనేషన్ ఇస్తాను. విచ్ ఆఫ్ ద ఫాలోయింగ్ ఈజ్ అ మెథడ్ టు టెస్ట్ ద టైప్ ఆఫ్ ఇమల్షన్? మీకు ఇచ్చిన ఆప్షన్స్ మైక్రోస్కోపిక్ మెథడ్, కండక్టెన్స్ మెథడ్, కోయాగులేషన్ మెథడ్ అండ్ డై మెథడ్. ఆప్షన్ డి ఆల్ ద అబౌవ్. మీ ఆన్సర్ ఆల్ ద అబౌవ్. ఎక్స్ప్లెనేషన్ రాసుకోండి. ఫర్ ఈచ్ అండ్ ఎవ్రీ మెథడ్ యు రైట్ ద ఎక్స్ప్లెనేషన్. మైక్రోస్కోపిక్ మెథడ్ అంటే ఇట్ ఇన్వాల్వ్స్ ద అబ్జర్బెన్స్ ఆఫ్ ఇమల్షన్ అండర్ మైక్రోస్కోప్. మనం పార్టికల్ సైజ్ ఎంత ఉంది, వాటి అరేంజ్మెంట్, డ్రాప్లెట్ సైజ్ ఎంత ఉంది, వాట్ ఈస్ అరేంజ్మెంట్ ఆఫ్ డ్రాప్లెట్స్ వీ కెన్ సీ అండర్ మైక్రోస్కోప్. కండక్టెన్స్ అంటే ఇట్ విల్ ఇన్వాల్వ్ ద మెజరింగ్ ఆఫ్ ఎలక్ట్రికల్ కండక్టివిటీ ఎంత ఉందో మనం మెజర్ చేయగలుగుతాం. అంటే ఆయిల్ ఇన్ వాటర్ టైప్ ఆఫ్ ఇమల్షన్స్ లో, వాటర్ ఇన్ ఆయిల్ టైప్ ఆఫ్ ఇమల్షన్స్ లో వాట్ ఈస్ ద ప్రెసెన్స్ ఆఫ్ ద చార్జ్? పార్టికల్స్ కి చార్జ్ అయితే ఉంటుంది కదా, what is the charge present? We are going to measure in the conductance test. Coagulation method ante దీంట్లో మనం ఒక సాల్ట్ సొల్యూషన్ యాడ్ చేస్తాం. ఇమల్షన్ కి మనం ఒక సాల్ట్ సొల్యూషన్ యాడ్ చేస్తాం. సో ఆఫ్టర్ యాడింగ్ సాల్ట్ సొల్యూషన్ ఇట్ విల్ ఇండ్యూస్ కోయాగులేషన్ ఆర్ ఫ్లాక్యులేషన్ ఆఫ్ ద డ్రాప్లెట్స్. ఆ డ్రాప్లెట్స్ అన్ని దగ్గరకు వచ్చేస్తాయి. సో ఇట్ ఈస్ యూస్ టు డిటర్మైన్ వాట్ టైప్ ఆఫ్ ఇమల్షన్ బేస్డ్. ఆ టెక్స్చర్ అపియరెన్స్ ని బట్టి మనకి ఏ టైప్ ఆఫ్ ఇమల్షన్ అనేది తెలుస్తుంది. దెన్ డై మెథడ్ అంటే ఒక స్మాల్ అమౌంట్ ఆఫ్ డై, స్కార్లెట్ గ్రీన్ డై ని మనము దాంట్లో ఇంట్రడ్యూస్ చేస్తాము. విత్ ద రిజల్ట్ ఆఫ్ డై కలర్ వీ కెన్ డిటర్మైన్ వాట్ టైప్ ఆఫ్ ఇమల్షన్ ఇస్. సో అన్ని టెస్ట్లు కరెక్టే. యువర్ ఆన్సర్ ఆల్ ద అబౌవ్ ఇస్ కరెక్ట్. నా పీడిఎఫ్ లో నేను చేంజ్ చేసుకోలేదు, బట్ మీ ఎడ్మింగిల్ యాప్ లో చేంజ్ చేశారు. Is that clear for you? Okay, it is already too late. Saukya ma'am is waiting. .2 correct.